the Dutch Kidney Foundation for years with great success. And at the office, we aim to support our patient experts, more than 100 of them, in all they do. By involving patients in everything we do, we prevent professionals and ourselves to design fake solutions. Because we take into account the needs and the wants of the patients from scratch. That's also prevention. That's why it is our goal to be involved in innovation and development in every stage, from idea to implementation. We take patient expertise seriously. Do you as well? We know not everybody does that yet. And let me give you an example. I received a letter from the Zorginstituut Nederland concerning our advice on the admission of a new medication on the Dutch market. It said, please respond in 10 days, accompanied by 3 times 80 pages of medical science and knowledge. And we know that it's a hard way, R&D. It takes about 10 years to develop a new medication. Zorginstituut Nederland takes about 3 months. And patients get 3 days? Well, we had been involved before, because we were asked to sign a funding letter, a supporting letter, to get the funding done. But we want to have this really different. And I asked the Zorginstituut, and they said, well, frankly, we don't get an answer that often. We're processing that now. We're trying to improve that process together with the Zorginstituut, because we can contribute in a better way. And this happens a lot. Patients experts are asked to comment on plans made, ideas made into products, and services ready to be implemented. But patients have so much more to offer. I've learned in the last few years we're missing chances there. And maybe you're familiar with these stairs, the stairs of patient participation. Information is the lowest, consultation, collaboration, and then control. That's not what we're striving for. But at the Dutch Kidney Patient Association, we think it's better to do it the other way around. We can contribute in all stages. Patients, experts have so many talents from life, as scientists, as parents, as caregivers, from their work, from their education, and from being a patient. So we can help with information for investigators, patients, boardrooms, storytelling. We can translate the text into patient-friendly text. We can offer advice, for example, on patient-related outcomes, with focus groups, with questionnaires. And we can give real advice on scientific processes, because we have scientists that are volunteers in our groups. We can work together in inventing real solutions to real problems and not fake solutions. We can prevent that. And we can help evaluate and learn from the patient's perspective. Some of you might think, well, but the patient's opinion and its story, that's only N is 1. But if organized well, patients, experts can add so much, and they can stand for their peers' opinions as well. We recently decided that our volunteers groups should be renamed. We call them patient advisory boards now, because patient experts are more than volunteers. Our organization now has advisory boards in research, medication, auditing, quality of care, language, and many more to come. Because patients, experts know what matters to them and their peers. And I invite you to become more curious to what matters to them. You will be surprised. Just look for them at, for example, ikzoekenpatiënt.nl from the Patient Federation. So, innovators, allow yourself some help. Finding purpose, creating ideas, a different perspective to your idea or work, knowledge from everyday life from people who live a life with a disease. Receive honest feedback from them and realize more impact on your work and on patient life. Prevent fake solutions. And I started my talk with saying that I'm the wrong person in the right place. Why is that? because I hope that next year patient experts will be standing on this stage talking about your innovations and why they matter to them. Let's find out together. We'll be at a table in the network table area to meet you if you want to, and I wish you a very, very good meeting. Thank you so much.